Today we are going to discuss about the drug profile of salbutamol. Salbutamol is a selective beta-2 adrenergic agonist. Considering the mechanism of salbutamol, then there is a B2 receptor. When salbutamol passes through the B2 receptor, it goes to the G protein and then the ATP is converted into cyclic AMP, and there is the inhibition of calcium release, and then it leads to smooth muscle relaxation, which is the main role of salbutamol. Also, the increased level of cyclic AMP is associated with the relaxation of bronchial smooth muscle. Considering the therapeutic indications of salbutamol, it is mainly involved in the treatment of asthma and exacerbations of asthma. It also prevents the exercise-induced bronchospasm or before the exposure to known unavoidable allergen challenge. Then looking the contraindications of salbutamol, these include that the salbutamol inhalation is contraindicated in the treatment of threatened abortion or premature labor, and the patients who have a history of hypersensitivity are also contraindicated for use of salbutamol. Next, we will be discussing about the undesirable effects of salbutamol. These include common reactions caused by it, serious reactions, and uncommon reactions caused by it. Some common reactions include muscle cramps, hypokalemia, that is the high doses of potassium, nausea, palpitations, and tremors, while the serious reactions include bronchospasm, paradoxical, hypertension, and hypersensitivity, while there are some rare reactions that are caused, which includes throat irritation, vasodilation, and akathisia. Next, we will be discussing about the pharmacokinetics of salbutamol, in which first one is the absorption. It is absorbed in 1 to 4 hours after administration. Considering the distribution rate, it is approximately 10 to 25% in the lungs, and it is weakly bound to plasma proteins. Next is the metabolism of salbutamol in the body. Salbutamol is metabolized by oxidative deamination and also through the process of glucuronidation. Last is the elimination of the salbutamol, in which the elimination half-life is about 2.7 to 5.5 hours, and approximately 58 to 78% of dose is excreted in 24 hours spent time. Next, we will be discussing about the drug interactions of salbutamol. So first, there is increased risk of hypokalemia if it is used with amphotericin B, beclomethasone, dexamethasone, furosemide, or hydrocortisone. There is also an increased risk of cardiovascular side effects if it is administered with atomoxetine. There is also an increased risk of glaucoma if salbutamol is interacted with ipratropium. Also, there are increased risk of hypokalemia and torsades de pointes if salbutamol is administered with fluconazole, lithium, or any other like drug.